One of the biggest mistakes I see scoliosis patients make is focusing on exercises without understanding their curve pattern and shape of their scoliosis. And because of that, some scoliosis patients spend months or even years doing some exercises that have no results because it doesn't match their curve pattern. In this video, I'm gonna explain you why this happens and how you can avoid that. Most people think that scoliosis is just a side curve, but scoliosis is actually a three-dimensional condition. I'm gonna explain you in simple terms. The spine is not just bending left or right, but it also rotates where it stands. It's rotating, it's twisting. It rotates your pelvis and your rib cage. It rotates your entire rib cage. So that being said, scoliosis is not just a side curve. It's also three-dimensional rotation and twist. If your scoliosis exercises only target side bend, which is just one component, you are leaving the main driver of the deformity untouched. This is where many people get confused. Two persons can both have scoliosis, but their curve pattern is completely different. One can have lumbar scoliosis, other can have thoracic scoliosis, and other guy can have S-type scoliosis, which is double curve. And also there's other type which is combined with kyphosis or lordosis. It's more complex cases. And you have to also understand that there's functional and structural cases. These are not the same type of scoliosis. The functional case is mainly side bend, but structural case is side bend and plus rotation. So just keep in mind, structural cases are harder to correct, but it doesn't mean it's impossible. It just takes longer time than functional cases, all right? And because of those spinal pattern differences, one correction can help one person, but it can completely hurt other one. So you cannot watch YouTube exercises or some online trainings and copy paste it at home or in the gym. You are actually reinforcing your curve. You have to have a personalized training plan tailored for your curve. If you are watching exercise on YouTube about thoracic curve and trying to do it at home with your lumbar curve, you're gonna actually hurt yourself. There is C-type scoliosis, S-type scoliosis. There's many types of curves, and every curve pattern is different, and your training must be personalized around that. The training must be unilateral, tailored for your weaker concave side and tighter convex side. You have to pay attention to those. And apart than concave and convex side, there's also three-dimensional deformity, which is rotation. So you have to do derotation exercises for that. So the training must be combined of decompression, derotation, and unilateral strengthening. These three pieces are the most important thing in scoliosis correction. Random scoliosis YouTube exercises show just stretching or only strengthening or bilateral both-sided strengthening or unilateral wrong-sided strengthening for your curve. So you should never ever copy any YouTube exercises or some random exercises. Please guys, stop copying random YouTube exercises. I personally trained more than 1,500 clients in the gym. I helped many people avoid scoliosis surgery. When I first meet a client, I always do assessment. Assessment consists of ribcage rotation, muscle imbalances, and general postural issues. So I give tests such as Adam forward bend test to see the ribcage deformation, and that ribcage deformity always comes from 3D rotation. So when you're bending over one side of your rib is higher than the other, it means you have ribcage rotation. It means it's vertebral rotation which pushes your ribcage. And besides that, I always check weaker muscles and tighter muscles. Weaker muscles are usually at concave side, and I focus at those concave sides with unilateral strength training, such as unilateral one-sided rows or unilateral one-sided glute bridges. I stretch and decompress the tight convex sides because at that side spine is bent, curved, and muscles are compressed there. So that is the tight side. It needs targeted stretching and decompression exercises. Breathing patterns is also changing with scoliosis. If you have right bend thoracic convex curve, your concave side is weaker. So you need to do unilateral breathing exercises to expand the left compressed concave side. So with scoliosis, breathing, unilateral strengthening, decompressing, and rotation, everything must be personalized. You understand? Every component must be personalized. You cannot copy-paste random exercises from YouTube or Instagram or whatever, because these exercises are not tailored for your curve. As I mentioned before, two persons can have scoliosis, but their curve pattern is completely different. When you copy-paste exercises, you are actually reinforcing your curve, which is increasing your curve pattern, which is increasing your curve degree. Instead of asking what exercises are best for scoliosis, ask what exercises are best for my scoliosis curve pattern. So correction plan must be specifically tailored and personalized for your curve pattern. And your progress must be monitored month by month. In my methodology, when I train someone with scoliosis, I reassess her posture, ribcage deformity, muscle imbalances every month because compensation patterns change month by month. What works in first month can change in second month. What works in second month can change in third month. So you cannot copy paste same exercises back to back many months. So exercises must be personalized month by month. Here it's progressive loading, and consistency is very important. When I say progressive overload, it means we have to increase the intensity of exercises and weight gradually, slowly. I don't mean you're gonna do 100 kg or 200 lb deadlift or something. I avoid exercises such as deadlift, barbell squat, overhead presses, because these exercises are the worst exercises for spine. They are directly compressing your spine. Our goal is to decompress your spine. When you do my exercises, the most important thing is consistency. You have to consistently follow the training. If you are struggling to understand your scoliosis curve pattern, or if you have tried so many scoliosis exercises but see no visible change, I actually create a personalized online assessment. You can actually scan the QR code on screen right now, or simply go to the description and click my website, SpineX.digital, and book your one-on-one online consultation with me. And if you found that video helpful, subscribe and ring that bell button, because in the future, I'm gonna share more detailed scoliosis correction exercises and strategies. See you in the next video.